Throughout most of the 19th century, doctors rode their horses to make house calls on patients, with their instruments and medicines carried in saddlebags. The medical knowledge they carried with them was limited by the science of the times.
A lot of his work was traveling on his horse in the countryside, attending people who were sick with very few drugs.
And they did the best they could with what they knew, but they didn't know very much. A Boy Scout with his merit badges or a licensed practical nurse right now has more genuine medical first aid information than a pre-1890 physician would have had.
Most would-be doctors of the 19th century served 1 or 2 years as apprentice to an established physician, then took 2 semesters of classroom lectures at a medical school. There was no lab work, no licensing procedure, no board certification. It was the age of heroic medicine.
If a person was pretty sick, doctors would give them massive doses of castor oil. And the castor oil would flush them out both ways. It would make them vomit and it would give them diarrhea. And they would get dehydrated. I mean, the age of historic medicine, the doctors were heroic, but the patients were even more heroic.
A young doctor started with his saddlebags filled with the vilest tasting drugs such as rhubarb, aloes, a package of Peruvian bark with which to make a decoction to stop chills, and calomel to salivate his patients if first bleeding, puking, and purging did not cure or kill him. With this outfit and a horse, bridle, and saddle, the young country doctor awaited his first call. Dr. W.C. Blackman.